Hello, welcome back. The topic today we are going to discuss is jaundice. All of us, at least once in our lifetime, would have jaundice. What is this jaundice? Jaundice is not a disease, it's a symptom of some disease. So, again and again, we tell you jaundice is not a disease, it's a symptom of some other disease. Okay, usually we know how to look for jaundice. They look at the eye, the white of the eye becomes yellowish, or the skin becomes yellowish, or the urine becomes very yellowish. This is how people know that they have a jaundice. Okay, what are the reasons for jaundice? The reason why the jaundice comes is because of elevated bilirubin in the blood level. What is a bilirubin? Bilirubin is a yellowish orange pigment which comes from the breakdown of red blood cells. We have a RBC, the red blood cells, which are constantly broken down and metabolized in the liver, and they are excreted. When the production of bilirubin is high because of high red cell destruction, or metabolism is very low in the liver, then jaundice comes. Okay, what are the reasons? It could be sometimes very normal, that's called physiological jaundice, especially in the newborn. Most of the newborn, almost we can say every newborn is born with some mild jaundice, which usually cures on its own. That's why sometimes they keep the baby below the tubelite. That's called physiological jaundice, which needs no further investigation, anything that can get cured on its own. Okay, the other reasons, we can divide this into surgical and medical jaundice. Medical jaundice is the treatment is only medical treatment or only observation. The surgical jaundice, most of the time, invariably they end up in surgical treatment to reduce the jaundice. Okay, even in the medical jaundice and surgical jaundice, we can have one more classification. We can say pre-production of bilirubin problem, production of bilirubin problem, post-production bilirubin problem. What is the pre-production bilirubin problem that comes under medical jaundice, where the best example is hemolytic anemia. In hemolytic anemia, the body destroys the RBCs. The destruction is too much. They end up in anemia, and too much of red cell destruction, too much of bilirubin, which is not metabolized in the liver, so the jaundice comes. There are different types of hemolytic jaundice, which has a medical treatment, so easily that can be treated. The reason is hematoma, we call that. Suppose you have a large hematoma, blood collection outside the blood vessels, so that can cause again jaundice, high bilirubin level causing jaundice. The next is the bilirubin production level jaundice, that is in the liver. When the liver is damaged for some reason, then the bilirubin level increases, that goes with the blood, causing jaundice. Okay, what are the reasons? The first and foremost, we can say hepatitis viruses, like hepatitis A, B, C, D, E. We have so many viruses, except B and C, all are fecal-oral transmission, like through the water or unhygienic toilet training, that can cause jaundice. Especially that happens, hepatitis A usually happens in the summer time. Then automatically that gets cured off. So that is a hepatitis virus, or Coxsackie virus, or even infectious monovirus, we call that. These can cause viral hepatitis, causing high bilirubin and jaundice. The next is alcohol. Alcohol directly can damage the liver cells, hepatocytes, liver cells. When the liver cells are damaged, they may not be able to easily metabolize the bilirubin, so the bilirubin rises, goes to the blood, causing jaundice. Or if the patient has a long history of chronic alcoholism leading to cirrhosis of liver. Cirrhosis of liver, the liver shrinks, the hepatocytes are destroyed, causing jaundice. The next important thing, the production level is, or the liver injury level is medicines. Even a simple paracetamol, which you can get over the counter for headache, fever. If the patient is sensitive, the patient's liver is sensitive, that can damage and cause jaundice. Anabolic steroids, estrogen, or or even chemotherapy medications, they can cause easily jaundice. And other reasons, autoimmune diseases. Any autoimmune disease that causes injury to the liver can cause jaundice. Okay, these are all medical jaundice or pre-production and production side jaundice. The next is surgical jaundice or obstructive jaundice. What is that? The bilirubin, everything is formed, but it's all because of some surgical condition. Like suppose they have a gallstone, because of that they can get jaundice, or the stone travels down, goes and blocks the common bile duct. It obstructs the bilirubin flow, then it can cause jaundice. Or the obstruction is because of some tumor in the cholangiocarcinoma, like they have a tumor in the bile flow duct or the pancreas or even the small intestine. These can cause jaundice, or any other cancer causing metastatic liver diseases can produce jaundice. So these are the surgical jaundice, probably which may require surgical intervention. What is the difference between biggest difference between medical and surgical jaundice is, in surgical jaundice, apart from the yellow color, loss of appetite, yellow color skin change, urine, they have a itching. They have a jaundice with itching. Then it could be surgical jaundice. They will have the motion color changes, clay color or pale color of motion with the jaundice indicates surgical jaundice. Okay, how to diagnose? Usually when you go to the doctor, again, like any other disease, first is the history. The doctor will ask so many questions, whether you have pain, fever, you have a bleeding or weight loss, something. These are the questions generally they will ask. Then they will do examination of the abdomen, examination of the the other areas. So in the abdomen, they look for any pain, look for any mass, liver enlargement, gallbladder, whether the gallbladder is palpable. Do a rectal examination, look for any rectal cancers. They look for any lymph nodes. All these examination, the doctor will come to a conclusion. It could be medical or surgical jaundice, or even they may be able to pinpoint, okay, this is all because of alcohol, this is all because of some cancer. They can come to a conclusion. Then they will ask for blood test. The simple test is a blood test that called liver function test, that will show the bilirubin level. The bilirubin has a total bilirubin, indirect and direct bilirubin. Usually direct bilirubin are all because of the surgical jaundice. Indirect bilirubin mainly because of medical reasons. And they also look for urine tests, bile pigments. If they are present, mostly they are all because of medical jaundice. So simple blood test of liver function test that will tell you that you have a jaundice or not. Not only the bilirubin level, the liver function will have a SGOT, SGBT, alkaline phosphatase, all these things, your albumin level, protein level, these things can give extra information to the doctor to know what could be the reason for the jaundice. Whether it's a drug-induced jaundice, all these things you can get. Then the doctor will definitely ask for a very simple ultrasound. Ultrasound is a very simple test which can generally differentiate between medical and surgical jaundice, like gallstones, CBD stones. All these things can be easily differentiated. Then the doctor may ask for a CT scan. He may ask for a MRI, especially MRCP. They may ask for endoscopy, colonoscopy if they suspect some malignancy. So these are the tests where we can know the jaundice and reason for the jaundice. Because the jaundice is not a disease, it's a symptom of other diseases. So if suppose you have a jaundice, don't think you can, with alternate medicine or home medicine, you can cure jaundice. It could be some other reason, like even a cancer, which can endanger your life. So if you have a jaundice, go and see a physician or a doctor who will evaluate you, look for the reason and treat the disease. When you treat the disease, the jaundice disappears. We don't treat the jaundice, we treat the disease. That is why in alternate medicine, some branding, people put some hot iron, some they have the sacred threads, they have a Ayurveda, Siddha medicines, which will, one medicine cannot cure 1,000 diseases which can cause jaundice. Very simple. If they give one medicine for all jaundice, definitely it's a stupidity. So if you have a jaundice, visit a doctor, know your reason and get yourself cured. Thank you.